Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health and the Center for Men's and Women's Urology, coming to you with another segment from Portland, Oregon. And I want to talk to you today about a condition that I've seen a lot of lately. And I like to take these video segments not only from the questions that you send in, but also from experiences that I have in the office. And sometimes there are situations that we see in clumps, and this just happens to be one of them. For instance, lately I have been seeing several patients with recurrent urinary tract infections. Now, while that's not unusual, of course, what is a little unusual is that in the last 2 weeks, 2 patients have been diagnosed with a colovesical fistula. Now, what that means is big, long term, and it's hard to say. But what it means is there is a connection between the colon and the bladder. And these patients start suffering from recurrent urinary tract infections, as well as oftentimes seeing blood in the urine. They oftentimes have abdominal pain or back pain, and it presents generally as basic recurrent urinary tract infections. So when we get the imaging studies, in this patient's particular situation, she has had a history of fistulas in other areas, so between the colon and the vagina, and those have been repaired in the past. Well, she came in with recurrent urinary tract infections and some abdominal pain, and with that history, I ordered a CT scan, and the CT scan showed air in the bladder. And it also showed that the colon had a perforated diverticulum, which is an outpouching of the colon that can become infected. And when those become infected, that can attach itself to the bladder because the colon and the bladder lay right beside one another. And so then the bladder in turn becomes inflamed and can develop a tract between that diverticulum and the colon and the bladder. Now, what does this mean? Aside from recurrent urinary tract infections and potentially seeing blood in the urine, patients can also experience air bubbles passing in the urine when they go to empty their bladder. Abdominal pain. They can also experience low back pain. And if it's an acute event, meaning it's happening right now and it's very inflamed, it can cause fevers and chills. Now, generally, how we fix this, it will oftentimes require surgery that is coordinated between a urologist and a general surgeon or a colorectal surgeon, such that the general surgeon or colorectal surgeon repairs the part of the colon or even perhaps takes out the part of the colon that's affected. And the urologist then repairs the part of the bladder and will sometimes cut out that part of the bladder that's affected and stitch the bladder back up. So yes, that generally does require, a few nights stay in the hospital and generally a catheter in the bladder for several days to allow the bladder to heal. But in most instances, it can be very treatable, and it's something that can be remedied. Now, depending on the severity and the acuity of the circumstances would depend on how it's repaired and when it's repaired. But if you are somebody that has scenarios and conditions like inflammatory bowel disease, like Crohn's disease or ulcerative colitis, or you have a history of diverticulitis, those infected outpouchings of the colon, keep in mind this is something that can happen and you can be prone to, that you may develop a fistula between the colon and the bladder. So if you start experiencing recurrent urinary tract infections or feeling the passage of air bubbles when you pee, and you have the inflammatory bowel disease or other colon issues, keep these things in mind and perhaps talk to your doctor about not only seeing a general surgeon or a colorectal surgeon, but seeing a urologist for workup of these issues. So hope this helps. It's a little more of a heavy topic than we usually discuss, but certainly something worth discussing because we do see these sorts of things. So hope this helps. Keep sending in your questions, and as always, thanks for letting 360 Pelvic Health Institute help restore your confidence.